My name is Jenny Earhart and I'm the Group Chief Finance Officer here at MFT. I'm really pleased to have this opportunity to present the Trust's accounts for 2020-21 and to update you about our financial plans for the current financial year. Inevitably, the coronavirus pandemic, notwithstanding the horrendous impact on patients, also had a significant impact last year on all Trust's financial positions. It also continues to have a financial impact on both our income and our spending, and I'll explain how we are managing these. First of all though, I'd like to thank our finance, procurement and informatics teams for their tremendous work throughout the last year. They have provided excellent support for colleagues across the whole Trust. I'm very grateful for the positive and collaborative way that everyone has responded to these ongoing demands of an extraordinary situation. So moving on to our financial performance through 2020-21. I'd like to begin by outlining our income and expenditure. MFT is now the largest trust in England, with income in the last financial year of over £2.1 billion, split between £1.9 billion for patient care activity and £0.25 for other operating income for education, research innovation and other things. As a response to the pandemic, the normal planning process that's carried out on an annual basis to agree how much income we get from our commissioners was paused, and a new NHS financial framework was introduced in April 2020. In the first half of the year, the framework was based on a fairly simple model, whereby commissioners paid a monthly block value based on the previous year, together with an adjusting top-up, which was made retrospectively to bring the Trust to a break-even financial position. For MFT, this came to £142 million and included the costs of the Nightingale Hospital. Therefore, the extra costs which we had relating to COVID, which were offset by a reduction in costs relating to the reduced levels of planned surgery, were paid for at a net level. This provided stability in the short term as the Trust responded to the pandemic and as it began to restore services during the summer 2020 recovery phase. From a behaviour point of view, there was a risk in this regime that trusts would become used to not paying attention to how much was being spent. Within MFT, we instituted governance mechanisms to guard against this, including approvals at the COVID Strategic Command and through the Executive Director team for some investments. We also continued to ask the clinical and operational teams to make sure they were paying attention to the most efficient and effective way of delivering care. In the second half of the year, the framework largely continued, but the top-up arrangement was modified and split into Greater Manchester system monies under the headings of top-up and COVID, of which we got £33 million to support break-even and COVID costs, and growth, of which we got £52 million to support inflationary costs and investments such as in mental health. In addition to this change, a small number of items continued to be reimbursed directly, and for us that included vaccination costs and the Nightingale Hospital. The Nightingale North West Hospital was built and opened over a 2-week period in April 2020 in response to the COVID pandemic. This temporary hospital was created within the Manchester Central Convention Centre in order to provide additional bedded capacity to respond to an expected surge in hospital admissions. Closure of the hospital and its subsequent decommissioning was announced in March 2021. MFT hosted the Nightingale North West Hospital, and as a result, the majority of the financial transactions were processed by the Trust and are reflected in the Trust's accounts for 2020-21. The total cost incurred by MFT for hosting the Nightingale North West in the year was £39 million, which was reimbursed through the financial framework. Nearly half, 48% or £920 million of our patient care income comes from local and regional clinical commissioning groups, which pays for services like maternity, community services like district nursing and accident and emergency services. Over a third, 34% and £644 million of our income comes from NHS England, who pay for more specialised and complex care, such as paediatric services, cardiac, transplantation such as heart, renal and pancreas, and genomic medicine. For the 2020-21 financial year, MFT had an income of £2.16 billion and expenditure of £2.15 billion. We had an operating surplus before finance costs of £3.5 million. We spent over £1.2 billion on our staff in 2021, Since the acquisition of North Manchester General Hospital on the 1st of April 2021, we now employ over 28,000 people who deliver excellent care across our hospital and community services. A further £197 million was spent on a wide range of supplies and services, and the Trust used £28 million of consumables relating to the COVID response. The cost of drugs was £196 million, and we also spent over £64 million on research and innovation, which is a key part of our strategy. We also spent £134 million, including from charitable donations, on capital schemes to improve the experience of our patients and staff. This included £54 million on buildings and facilities, investment of £20 million in new equipment, and £23 million expenditure on information technology. Charitable donations make a significant difference by helping to fund care, treatment and research across our hospitals and community services. A huge thanks needs to be recorded to individuals, families, community groups, companies, organisations and our own staff, and over £9.2 million was raised by our charity in 2020-21. Alongside buying additional equipment and improving the patient experience, we also prioritise spending on staff wellbeing and mental health support. I'd now like to share with you the current financial position and what we anticipate will happen for the remainder of the 2021-22 financial year to the end of March 2022. The same COVID financial regime has continued into this financial year, and we continue to face financial challenges. In May of this year, we submitted a financial plan to NHS-INE for the first half of the financial year that showed the achievement of a break-even position. A further plan for the second half of this financial year will be required in the coming months, for which we are currently awaiting guidance. As a trust, we have set a budget for the full 12 months of 2021-22. We felt it was really important to set a full year plan in order to understand our position, our pressures, risks, and to establish the waste reduction requirement of £50 million for the year. We are expecting financial regime information and planning guidance for the second half of the year to be released soon, and we will review and revise our financial plan for any changes as a result. For the first 4 months of 2021-22, we have achieved a surplus of £2.4 million. As a trust, we need to achieve a surplus in the first half of the year of £23.1 million to support the investment in our capital programme. As we look to the future, I'm confident that we will continue to manage our resources effectively, ensuring our patients get the best possible care. Whatever the challenges ahead, everyone in Team MFT will play their part. We know that together care matters.